And you find this tool in on the webpage that you got at MIT-UIB. Here you find basic information about the tool, the work we do. You can learn about the methodology, what the input is for the tool if you would want to. And here, this is also where we plan to build up a library with films and similar to the course. We will reorganize this in the next couple of months. You find some user guides where you both find a manual for policymakers. If people would want to work on development, work with a core development team in FairChoices, there are some instructions, and this is the methodology description, and this is the architecture of the data. So that's sort of background, and you can see a bit about the projects, what we do in FairChoices, and some publications, how you can get in touch with us. But most importantly, you launch the tool. So this is the tool. So step one in your exercise is to choose one country, and I can, since Krishna is watching and paying attention here, I will choose Nepal. This is special for Krishna, and I know many of you, the participants, are from Nepal. And the second task that you will do is to look at, okay, how much can we increase the health budget over 10 years? And unfortunately, there is a bug here. It starts in 2020. It should have been 2025 because this is a bit outdated, but you have to imagine that this is 2025 and this is a 10-year scale-up period. And if you continue business as usual, there is made a linear, just a simple linear regression analysis saying that based on this historical data, this is how much the government in Nepal have spent up to 2020. And if this trend continues, they will increase the budget this much. But if you want to override it, you can say, let's double it. The government need to increase it much more. Then you change it. And then you also have external health expenditure, meaning donor rate. And now maybe you can be a bit more pessimistic and say, Trump will kill global health and it goes down to zero. It starts from zero next year and it will be zero for 10 years. I'm just making up, it's up to you to decide. So now we've removed the development aid from Nepal. So I'm just making a scenario people are maybe worried about, and maybe you would want to increase the private healthcare investments in Nepal to 10 and not you are more into private healthcare, maybe you're into less, so you can change it, maybe 2. And then also, if you are in favor of financial risk protection, maybe you want the out-of-pocket expenditure to be 0, but maybe that's unrealistic. You can put it at 10. And you can see this is the trend line, but you can override it. And given what you have overridden with, this will be the final budget. And then we see that you can change the starting year here as well. Sorry for that. So you need to have the end year 2025 to 2033. So then now you can download a picture of this, but you can see that the total budget will be around, I don't see the total here. It's a bit difficult to see, but it looks like it will be roughly $70. So going from around $55 in total to $70. So that means you have $15 per capita to spend on the essential healthcare package. So that will be your budget cap for when you will start defining the benefit package. And it's in the league table where you can create your own benefit package. And we have to remember now, I said roughly, let's assume Nepal can afford to increase the health budget with $15 per capita. That's your maximum. But the first task you were going to do is to say, okay, let's aim for a universal healthcare package. Everyone will get everything. So then you scale up all these interventions. We have 106 interventions here now. You scale them up from the baseline coverage level they are at. Some are at 0, some are at 8, some are at 51. but you are now the universal healthcare guy and you scale them all up to 100%. And whoops, this is the package. So then what you were going to answer is, okay, how much increase would you then need? And then it says per capita cost. So this is the incremental per capita cost. So that means you would go beyond the $15 per capita increase that we found realistic in the budget space analysis. But now this is much more expensive than what you actually can afford. But this is what you were going to answer. What would be the incremental cost? And that's $76.6. This is the extra cost in the whole 10-year scale-up period. And this is the extra cost in the end year, when you have achieved universal health coverage in 10 years from now. This is how many healthy years you would gain over the full period. And this is a 10-year scale-up. No, this is a 5-year scale-up period. And then this is the number of lives saved you would prevent in the whole period. And this will be the incremental cost effectiveness ratio, or the cost effectiveness of the whole package, dollar per healthy year gained and dollar per life saved. And you can see the package has around $1,964 per healthy year gained. So this is the universal healthcare package. You have all the information you need here on the right side. You could look into the details of any intervention if you want. You can look at, okay, this is now one of the interventions. If you look at the treatment of retinoblastoma, you can see this is the scale-up effects over a 5-year scale-up period. How many deaths averted in different age groups, how many deaths averted for the affected condition, which is retinoblastoma here. And then you also get deaths averted by age groups. And then you get the estimated deaths averted in total. And you have this also by age and cause. So this is an overview of the health effects. And then you can look at the demographic projections. You could also turn on and off fertility. That's a bit advanced, so we will not do that in this course. And here you will see the increase in expected budget impact of the package, and you can see the ICER of this single intervention. So you can get more detailed analysis of each intervention. So if you want to refresh the page, and let's start on package number 2. That was the health maximizing package. So then you were asked to order by ICER, and then you sort from low to high. So you have the most cost-effective interventions at the top. So then you just can click on this, and if you want to click many interventions, let's assume this is your willingness to pay threshold, $300 per healthy year. If you hold Shift on your computer press Shift, and then click, you will highlight all the interventions that have an ICER less than $300 per healthy year gain. Assume that's your threshold. And then you scale up these interventions to 100%. And then you could see the increase of this package, the budget impact was much lower. So that means you can afford to scale up more. You can continue. So then you go beyond the $300. So you actually have a higher willingness to pay threshold. So let's go to 1,000 and see if you can afford to give all these interventions 100% coverage. Now you're up to 8.66. It means you can still continue to scale up interventions. So you can go down to, let's say, our willingness to pay is this high, and we scale up to 100%. And now you see, oh, you're a bit too high. You have 19.75. We said that we could only afford $15 per capita increase. So maybe you have to remove this, and this. Let's take also cataract surgery, remove it, and you scale it down to 0 again, so that okay, now we're roughly at $15 per capita. So this is the package, and this is the cost effectiveness of the package. And you can see this is much more cost effective. It's a much better buy than the universal healthcare package that you had. and it's at a much lower budget impact compared to the UHC package. So now I did the health maximizing package, and I will reload it, and I will do the feasibility package. So then you can just select all, and then you just scale up all the interventions to 5%. So I'll type it here. It's probably easier. 5%, and then you click here. Now I scaled up all to 5%, and here you actually save a lot of money. So that means you need to identify interventions where you had a baseline coverage, because you're scaling down interventions now. So this one you need to set back to 0, and then you just so this is not the way to do it, because you need to be sensitive. What is the baseline coverage? So this needs to be set. So I'll redo the whole thing, and I will target all, and then if but I'm a little bit this was okay, this is a bit challenging, so you need to go through each and every intervention here. So is Persona here?
No, Kjell Arne.
No, he's not here. So what I suggest you just skip this package, because there is not a technical feature where you can only scale it up easily with 5%. So skip this package, and we can try to do the we can rank order the interventions by lifetime health. And then you get the most severe conditions at the top, and then you do the same as you do with the ICER package, and you can scale up, and you can scale these up to 100%. And then you see this is almost at the level where we it's $10 per capita increase, but much less in interventions. And you can see the cost effectiveness of many of these interventions are much higher than what we saw earlier, and that's why you get a very high opportunity cost. So this is the healthy years lost compared to investing in the most cost-effective interventions. So this is how you work, and then I suggest that you skip the feasibility option, because that's a bit the technicalities is not ready yet. And if you want information about the input for the different interventions, you have them all here. You could click on, for example, hepatitis C treatment. You can look at what the assumptions are for both effects and cost. So that was a quick introduction on how to use FairChoices, and now I will stop sharing.